Thank you all for joining us today. If you need access to record or would like to ask a question, please indicate so in the chat. Please also don't forget to mute yourselves as you enter. We are having quite a bit of background noise right now. Thanks again for joining us. If you need access to record or would like to ask a question, please indicate so in the chat. We will limit questions to one question per outlet on the subject matter today. In addition, we are limited to 1 hour with a hard stop at 2 o'clock. So if there are any remaining questions in the queue at that time, please send them in the chat and we'll work to get you a response in writing. Also, please I'd like to remind everyone to mute yourselves. We are hearing quite a bit of background noise right now.
Right.
Thank you all for joining us. Just a reminder to mute, and if you need permission to record or have a question, please indicate so in the chat. We are allowing a few more in from the waiting room and we will begin shortly. All right, thank you all for joining us. Dr. Vanderhoff, I believe we are ready to begin.
All right, thank you. Well, good afternoon. I'm Dr. Bruce Vanderhoff, Director of the Ohio Department of Health. And once again, I'd like to thank you for joining us today. As you've probably heard, this morning, the White House outlined a plan to offer booster doses of the 2 mRNA vaccines, Moderna and Pfizer, to fully vaccinated adults 18 and older, 8 months after their second dose vaccine. They anticipate this will begin on September 20th for those Americans who received the first doses of the mRNA vaccines in the winter, including older Ohioans, those in long-term care facilities and healthcare workers. It's important to note, however, that this plan is still subject to the FDA's independent evaluation and determination of the safety and effectiveness of a booster dose, as well as the CDC's Advisory Committee on Immunization Practices issuing booster dose recommendations based on their thorough review of the evidence. Of course, at this time, we're also reviewing the data and awaiting the scientific guidance and determinations of both the FDA and the ACIP. Nevertheless, today, the U.S. Health and Human Services reaffirmed that the COVID-19 vaccines authorized in the United States continue to be remarkably effective in reducing the risk of severe disease, hospitalization, and death, even against the widely circulating Delta variant. Now, we need to remember that protection against severe illness and death, which the vaccines continue to offer very robustly, was in fact the original goal of these vaccines. Vaccines against respiratory viruses rarely protect against mild to moderate infections, as well as they protect against severe illness, because they're much better at inducing immunity in the lungs than in the nose, where respiratory viruses first infect our bodies. Also, our immune systems are very robust and very complex and include both antibodies as well as special cells known as B cells and T cells. Doctors generally expect levels of antibodies to most respiratory viruses to decline over time, even for vaccinated people. That happens against most bugs. But in most people, the vaccines against COVID also created reserves of B cells and T cells, reserves that recognize the virus and lie in wait even after our antibodies wane. Now, this means that while immunity against more moderate infection may indeed begin to wane, our protection against severe illness and death is much more likely to endure. Here in Ohio, we continue to see troubling increases in COVID-19 cases statewide, with more than 3,200 new cases reported yesterday alone. That's the highest since February. The Ohio Hospital Association has reported that statewide, 1 in 13 patients in the hospital are there with COVID, and 1 of 7 patients in the ICU is battling COVID. And as reported across the rest of the country, this continues to be the unvaccinated who are driving these hospitalizations. These statistics are worrisome, and they clearly are the result of the dangerous and highly contagious Delta variant. Although we still have hospital beds and ventilators available for patients, as well as those facing other illnesses, the rapid spread of the threatening Delta variant statewide, especially in the context of our hospitals being very busy caring for patients with other serious conditions, brings heightened concern as reports continue to reach us from other states that hospitals there are beginning to turn away elective procedures and are even seeking to move patients to beds out of state. And of course, Ohio students are now preparing to go back to school, which adds additional concern about what impact that will have on our current trends. As Governor DeWine shared yesterday, Brevard Public Schools down in Florida reported that they started schools with masks as an option, and just 1 week later reported more than 1,000 students and staff in quarantine, with an additional 470 actual cases among their students and teachers. And when South Carolina's largest school district in Pickens County reopened without a mask requirement, in just 9 days, the COVID cases spread exponentially, with 168 students testing positive for COVID-19 and another 568 students and staff landing in quarantine. And they have shifted now, unfortunately, to a temporary virtual learning. And we don't want that to happen here in Ohio. Our goal is to keep our K-12 students in school in person 5 days a week. In-person learning, we know, is very important for the cognitive, social, and emotional development of our children. and it can be conducted safely, even in the face of COVID-19, particularly when our schools are able to employ the layered prevention strategies, which include masking, social distancing, good ventilation, and good hygiene practices, along with vaccination of our eligible people. Last spring, these practices created a very safe environment in our schools. When school districts implement these same layered prevention strategies across the state, we're confident it will enable uninterrupted academic experiences as well as extracurricular activities for Ohio students. In fact, our K through 12 quarantine guidance is built around these layered prevention strategies. And when a school requires masking for everyone, regardless of vaccination status, they are also applying maximizing physical distancing of at least 3 feet between desks, and they have other documented COVID prevention practices in place, including things like hand hygiene. We have indicated that students are able to forego quarantine if exposed in the classroom. In addition, even if a school doesn't have such procedures in place, but the student or teacher exposed is either vaccinated or consistently wearing a mask, they also will be able to remain in the classroom with some additional masking and or testing recommendations, as long as they are not experiencing symptoms. Quite simply, by choosing to be vaccinated or choosing to wear a mask, even if not required by the school, the student or the teacher benefit. And they avoid a constant vicious cycle of quarantining and returning to the classroom over and over again. So adopting layered prevention measures in schools now will help ensure that our students can learn in person as much as possible this year and keep our students participating in extracurricular activities. I want to turn to the topic of diagnostic testing, because diagnostic testing to detect COVID-19 and to help quarantine those infected really remains an important facet of disease surveillance, particularly in our schools, but also statewide. It's important to understand that testing is a little different this year when it, combined with some of our preventive measures, was one of the only tools that we had in our arsenal to fight COVID-19 last year. This year, the most important thing we can do to fight COVID-19 is actually to get a vaccine. But today, testing still plays an important role given the number of people who are unvaccinated, including those under 12 who aren't even yet eligible, and the 65% of Ohioans ages 12 to 17 who also aren't yet vaccinated, and the potential for these individuals to become infected with and spread the Delta variant. Now, one of the questions people often ask is, when should I get tested? Well, first, you should immediately be tested if you have symptoms of COVID-19, regardless of whether or not you're vaccinated or have previously had COVID-19. If you have symptoms, you should be tested. Or if you were in close contact with someone who had COVID-19, you should really be tested about 3 to 5 days after that contact. Unvaccinated people who've taken part in activities that put them at higher risk for COVID, such as traveling, attending large social or mass gatherings, or being in crowded or poorly ventilated settings, should also be tested a few days following the activity. As a precaution, people may also want to consider getting tested before they go to a wedding or a large event, or before visiting a vulnerable loved one. Testing lets you know if you have COVID-19 so you can respond accordingly, isolating to avoid further spread. Well, where can someone today go to get tested? Well, many people can now be tested from the comfort of their own homes. This was an option we really didn't have in previous months. We've made rapid at-home tests available for free through many of our local health departments, our libraries, and our other community partners. We've made these same Binax Now, that's the brand, of tests available to any school in the state who wants to use them. These proctored tests allow you to walk through the testing process on demand with a telehealth provider who will help you read the results and then report them to the state. You can also get a rapid test at many of our community health centers located throughout the state. And of course, you can continue to be tested at our pharmacies and many other providers. So until far more Ohioans choose to be vaccinated and the COVID-19 virus is no longer driving waves of hospitalization, testing will remain an important tool. And Ohio is committed to making it easy to access this testing as long as that is necessary. Well, as usual, I'm fortunate today to have frontline doctors joining me to share their experience at the bedside. And first, I'm joined by Dr. Michael Forbes, a pediatric intensive care specialist at Akron's Children's Hospital and the interim chair of the hospital's Department of Pediatrics. Dr. Forbes, people often mistakenly think that children just don't get sick from COVID-19. At Akron Children's, you've treated dozens of children with the rare but serious multisystem inflammatory syndrome of children, also known as MIS-C. Can you tell us about MIS-C, the symptoms children are coming down with, and what you know about the children and their illness? Did they have mild or severe cases? And what were most of these children like before their diagnosis?
Yeah, terrific series of questions. First of all, thank you for having me. And thank you for continuing to spread the awareness about what we can do to get control of this pandemic. So last year, as we all mobilized to deal with the surge that was happening in our state, we prepared to not only take care of adults if they ended up at our children's hospital here in Akron, but we also prepared to take care of children. And it turns out that we didn't see a lot of what we would call pediatric COVID. So again, COVID typically will present as respiratory symptoms. It gets worse and then maybe develop into a shock state. We really didn't see too much of that. What we saw in November, December, really in early January, when the adult COVID cases spiked, was about 4 to 6 weeks later, we saw children who were previously healthy, who had minimal symptoms. I remember taking care of one young boy who had one day, maybe half a day of the sniffles, but had a couple family members with COVID-19 who about 6 weeks later developed the multi-system inflammatory syndrome in children, or MIS-C that you referred to. He was extremely sick. We've taken care of about 65 kids so far with MIS-C. 44 were confirmed, 20 were suspected. And so overall, we're still seeing this syndrome. It reminded all of us last year that we were of a condition that we see also rare called Kawasaki's disease. And Kawasaki Syndrome is, again, mysterious in its origin, but the hallmark of it is the immune system really seems to go haywire. And there's multiple organ system dysfunction and failure as a result of not necessarily the bug that triggered it, but your own immune system really activates what looks like a self-destruct sequence. MIS-C looks just like that. And so while we initially thought we were dealing with a bad case of Kawasaki's, there were so many of these children with either the epidemiologic background, being exposed to COVID or actually having COVID, who were just incredibly sick. Roughly about a half end up in the ICU for us, primarily because, frankly, it's a brand new disease. We've never seen it before. We wanted to be really careful. And so we were on the lookout. And many of these kids presented with either cold symptoms, fever, diarrhea, with abdominal pain, and then very rapidly turned into multiple organ system failure due to really a hyper-inflammatory response to COVID. And so once we got a handle on it, I have to give a shout out to one of our cardiologists, Dr. Ira Taub, who had the presence of mind to say, we've never seen anything like this before in history. And so while New York and folks in California were giving reports about MISC, he had the presence of mind to build a local database. And so we have that data, we're learning from that. And I think it's really helped us to raise awareness about what it looks like, because it sometimes masquerades as something else. And the earlier you recognize it, the earlier you treat it, the better the kids do.
Well, thank you for that. Kids under the age of 12 aren't yet authorized to receive the vaccines. So as I was noting in my opening comments, it's really important for us to layer preventive strategies to protect them. But of course, a lot of our kids are no different than adults, and they were kind of looking forward to maybe a different world, a different picture. As children head back to school, what are your recommendations to families about what they can do to best protect their children?
Sure, great question. I think I would only echo what you said in your opening statements. In healthcare, one of the principles we go by is to prevent what's preventable, right? We do understand that diseases happen and that things can happen to people kind of like a lightning strike. But we prevent what's preventable. And I think we understand enough now about the propagation of the disease, the spread of the disease, and frankly, how to prevent the disease. And so I agree with what you said earlier in the opening statement. If you're 12 and above, you should be vaccinated. We have a highly effective, safe vaccine that has been very publicly evaluated, certainly seen and evaluated by any scientist who's careful enough to take a look at that data. We have a great vaccine. In addition to the vaccine, I think wearing the masks and choosing to wear the mask. Again, I like the way you opened up the discussion. I think choosing to wear the mask pretty much all the time, if you can, choosing to get the vaccine. We're in another phase of the pandemic now, where last year it was something we had never seen before. This year, frankly, it's something we can spread or something we can contain. And I think we have an opportunity as kids go back to school, knowing that there will be much more interaction. If you're eligible for the vaccine, please get the vaccine and wear a mask. It really will give us the best way to live with this, because it won't go away, I think, for quite some time.
Well, Dr. Forbes, knowing that vaccination and masking are really two of our best preventive strategies, and I really like the way you framed that and outlined that. What are you saying to parents who might actually have fears about the potential negative consequences of either vaccination or wearing a mask for their student, for their child?
Sure. I think as a parent whose child's about to go back in the middle of a pandemic, again, something we've never seen before, I think the fears of the unknown in particular are legitimate. I think we have to listen when parents express those fears. They know their children and they understand their children. My message to parents as your children go back to school is to echo what I just said a moment ago. If they're 12 and above, please get the vaccine. The concerns about side effects of the vaccine, adverse events of the vaccine, frankly, even some of the conspiracy theories and controversies about the vaccine, I think we hear those and we respond with facts. And ultimately, it is the choice of that parent. And if that child's engaged and certainly old enough, a choice for that child. But I would encourage you to get the vaccine and and wear the mask. What we've seen, and I think this is an important point to make. Again, wherever the virus came from or started last year, we may never know. We can speculate for a really long time. But we have the power to choose to end it, to end the spread, limit the propagation, and really, really minimize the impact of this virus and this pandemic on our culture. And I think we have to make the choice to do that. We have a great opportunity here and we shouldn't pass it up. What I'm concerned about as a pediatrician is last year we prepared for everyone to get sick from COVID-19. Lots of people got ill, of course, and many people lost their lives. Those who survived, among the survivors, many are disabled for quite some time. But we did not see a lot of pediatric COVID. As someone has said, I think in our White House, it's a new pandemic. It's different. It's changed. We are now seeing across the United States pediatric COVID and deaths due to pediatric COVID. So not only are the unvaccinated adults being, frankly, taken advantage of, if you may, by the virus, but now we have mutated the virus to the point where children are also being infected, being harmed, being critically ill, and even losing their lives because the virus was given opportunities to propagate and mutate. I think we need to stop that. And the way you're going to stop that and get back to school is to get vaccinated if you're eligible and wear your mask, frankly, if you're around any other person.
Thank you so much, Dr. Forbes, for that very well-stated message. Next, I'm joined by Dr. Craig Deuce, the Director of the Department of Emergency Medicine at Mercer Health in Coldwater, Ohio. Dr. Deuce, as an ER doc in a rural community, can you tell me a little bit about what you're seeing in the emergency department related to COVID-19?
Yes, thank you for having me today, Dr. Vanderhoff. As you mentioned, I am an emergency medicine physician working at Mercer Health in rural Mercer County, and we've certainly seen an increase in number of cases of COVID patients presenting to our ED over the past 3 to 4 weeks. A significant increase in both adult and pediatric patients. We've seen over a 500% increase in the number of patients being tested over the past month. Our positivity rate has went up to 27%, and that's up from 2.9% in the month of June. Patients are presenting with similar symptoms that we saw earlier in the pandemic, with the loss of taste and smell, congestion, cough, shortness of breath, headaches. However, it seems as though recently patients are presenting earlier in their illness. Earlier in the pandemic, we would see patients with 3 or 4 days of symptoms, and now frequently we're seeing them after 24 to 48 hours of symptoms. And I'm not certain if that's a reflection of the viral load and the increased infectivity of the virus and their symptoms occurring sooner or more rapidly within the illness, but it seems to be that we're certainly seeing them earlier in the illness than what we had seen previously in the pandemic. We have our highest number of hospitalizations since the early second quarter of 2021. In June, we went several weeks without any inpatient COVID patients. And now we're seeing at least 3 to 4 patients per day for inpatient care. The number of our positive cases, we're seeing approximately 80% of those as unvaccinated patients. Less than 20% are what we term now as breakthrough cases, patients that have been vaccinated that have tested positive for COVID. But by and far, those patients are doing well. Even though a minority of them have required admission, most of them have had very short length of stays and have recovered uneventfully from their illness. So from my perspective as a physician in the trenches seeing COVID patients every day, the vaccine is extremely effective in preventing serious illness in the COVID patients and preventing death in these patients. We're seeing about a 9% positivity rate as far as pediatric patients less than the age of 18 that are testing positive. I have not seen a significant number of critically ill pediatric patients thus far, but certainly we have concerns knowing that that is our highest risk population, those under the age of 12 not having a vaccine available, and now the continued exposure to the variant, the Delta virus, the Delta variant.
Dr. Deuce, so many Ohioans, quite understandably, are telling me that they are just worn out. They are tired of dealing with COVID-19. We've been dealing with this pandemic for about 1.5 years now. It has to be taxing, both mentally and physically, for you and your medical professional colleagues, the doctors, nurses, respiratory techs, et cetera, that you work with. How are you observing that medical professionals are finding it in themselves and among themselves to cope with this marathon and how might that help inform the community? What might we be able to share with the community about this thing that seems to be going on, but that we still have to deal with?
So you're exactly right. It's been a marathon, and it's been exhausting for myself and for the staff here at Mercer Health. First, I want to compliment our staff here at Mercer Health, as well as all the Ohio healthcare workers and healthcare workers throughout our nation, because it's been very challenging since the beginning of this pandemic. It is fatiguing, mentally and physically fatiguing. And I see it amongst our staff here at the hospital, because day in and day out, they're stressed to the maximum. We have high inpatient census requiring all of our staff to work very hard throughout their entire shift. Many of them have been required to pick up additional shifts to help support patient care. And yet this is a vaccine preventable illness. This is an illness that we can prevent the spread, and we can prevent serious complications. And personally, I see the way through this pandemic is first the vaccine, because it's the one thing that we have in our armamentarium that can prevent critical illness. And then additionally, other measures to prevent the spread of the illness. For example, as both you and Dr. Forbes have already mentioned, mask wearing, social distancing, and the things that we've discussed previously to prevent the spread. It is an exhausting virus on our staff at the hospital. Our administration at the hospital has worked diligently to help from a mental health aspect for our staff. We do things outside the hospital for bonding. We do a lot of educational series and things of that sort as well. But the best thing we can do to help our staff and all the healthcare workers throughout our nation is to get through this pandemic. And really that comes to preventing continued spread of the illness.
Thank you so much for that. Many Ohioans, as I shared with Dr. Forbes, have still considerable hesitancy about getting the vaccine. And I know there are many reasons for that. Some worry about side effects, some worry about long-term impacts, maybe even long-term impacts that they have not yet heard about. What would you say to an Ohioan who isn't yet sure if they should get vaccinated?
Well, I would encourage all Ohioans to seek reliable information, accurate information from a qualified healthcare professional. So first, I would encourage all of them to contact their primary care provider and have a conversation with them about the facts of the vaccine and the facts of the illness. And I think all Ohioans deserve to make an individual choice concerning the vaccine. But I think they'll make rational decisions when given facts about the vaccine. There are many misconceptions out there, whether it's from the vaccine was developed too fast, or they've had a prior COVID infection so they don't need the vaccine, or they're concerned about boosters and the duration of their immunity, or for example, the risk of blood clots and allergies. And I certainly understand those questions, but the medical literature has answers to those. And just for example, concerning blood clots, I recently had a conversation with a patient who didn't want to receive the vaccine because they have a strong family history of blood clots. And they felt as though if they received the vaccine, they would develop a clot and have complications from that. Yet the risk of developing a blood clot from the vaccine is less than 0.0002%. And it's extremely rare. You're more likely to actually be struck by lightning than to develop a blood clot from the vaccine. Yet, if a patient develops COVID, and particularly severe COVID, they have a 20% chance of developing a clot. So the risk is much greater if they actually develop the infection than if they were to get the vaccine. There's been many questions about the vaccine being developed too fast, too rapidly. It could not have been researched adequately. Yet we've been studying mRNA vaccines for decades. This goes back into the 1980s. And mRNA vaccines were looked at with HIV, with previous influenza, and really even with the previous coronaviruses, the SARS and MERS. So in some aspects, we had these vaccines already on the shelf, and they just had to be tweaked a little bit for the current coronavirus that we're seeing. lots of resources were thrown at the development of this vaccine. Okay, normally when we try to get approval for vaccines, we have to obtain grants to do the research, then we have to enroll patients, and that all takes time. In the setting of a pandemic, we were able to throw tons of money and resources at researching these vaccines. We had a lot of sick people that could be enrolled in the studies, so we were able to gain a lot of information very quickly. Some of it was luck, but part of it was we were already prepared and doing research on these types of vaccines before it was needed for this pandemic. A lot of people have questions also about immunity and natural immunity. And I know you've commented on this on previous conferences as well. But the vaccine gives a preventable or a predictable immunity versus being infected with the coronavirus. It's unpredictable. And that immunity may wane over time, or it may not be, they may not have immunity to the current variations that we're seeing with the virus, for example, the Delta variation. So I strongly support the vaccine. It gives us across the board a more predictable response in preventing serious illness and death from the coronavirus. I would really encourage everyone to seek factual information from their healthcare provider and make an informed decision. I can tell you the people of Mercer County are intelligent, rational, hardworking people, and they'll make an informed decision given facts. And I respect their decision, but I think they really need to seek advice from their healthcare provider and not necessarily rely on social media or rumors that circulate amongst, our neighbors, friends, etc.
Thank you so much, Dr. Deuce. And also thank you so much, Dr. Forbes. Alicia, I think we can move now to questions.
Thank you, Dr. Vanderhoff. Our first question is from Dan DeRose with WOIO.
Dr. Vanderhoff and Dr. Forbes and Dr. Deuce, thank you very much for your time today. Dr. Vanderhoff, even Governor DeWine brought this up yesterday, that he saw it on the news that in some districts, the anti-maskers are winning. They are showing up to these meetings. They are screaming at school boards that they don't want their kids to have to wear masks. With that in mind, do you think that it is only inevitable that what is happening in Florida, what is happening in South Carolina, what is happening in Louisiana in their schools, it is inevitable to happen here in Ohio? And is that your biggest fear?
Well, I'll tell you, I think that we can all agree that we all would like to see our students be able to have a successful launch to this school year. I don't think anybody in Ohio really wants to see children getting sick and having to miss school, children having to miss out on participating in their sport or their other extracurriculars such as band. But that's going to be, as you're pointing out, inevitable if we don't take the lessons that we are seeing from other parts of the country that are ahead of us on this COVID wave and have experienced just that. Schools that have begun the school year without much in the way of protection against the Delta variant of COVID-19. And Delta has spoken very loudly and made it very clear that, look, Delta acts almost like it views the unvaccinated like a magnet. And it is really just a matter of when someone who's unvaccinated and unprotected acquires the Delta variant and therefore ends up having to miss out on their education. So, we've had over the course of the past few days, I think, some wonderful dialogue with community leaders, with leaders of schools, with people in the public health community around this call to action, this call to put the education of our students first. And I've actually been gratified by how much of a response that people have voiced. I'm increasingly hopeful we're going to see more and more schools looking and saying, we are in the middle of a Delta surge. Let's put some protections in place, at least during that surge, protections that we can back away from it. Things are getting better. But I do feel bad for those schools and those students in those schools that won't have the benefit of those protections, both because we're going to have some kids who need not have gotten severely ill who do, and we're going to have a lot of kids who need not have missed out on in-person education and those wonderful and important extracurricular experiences that so often make up so much of our development and our fond memories of having been in school. So I'll turn to my colleagues, Drs. Forbes and Deuce. Dr. Forbes is a pediatrician. Maybe you could go first.
Sure, thank you for that, and thanks for the question. I think that I hope it's not inevitable. But as I've said to some of my colleagues recently, last spring, when we learned about what was happening in Washington State, I remember thinking to myself, boy, it really stinks to be in Seattle. Knowing full well that it's a pandemic, and pandemic means it's a pandemic. It's going to be everywhere. And then when it happened in New York City, we thought, wow, really, really stinks to be in New York. And before we knew it, it was everywhere. So I want to believe that at this point, a year and a half into this, we'll stop saying, boy, it really stinks to be in Atlanta. Boy, Nashville's having it rough, aren't they? We don't want that in Ohio. And so I think we have an opportunity right now to make sure it doesn't happen here. It may be too late, I don't know, but I want to believe that we have an opportunity right now, this crease, to get vaccinated before school starts if you're eligible, and wear your mask. And again, it's a choice, and I understand. I think Dr. Deuce very eloquently made it clear. We believe in the intelligence of Ohioans. We believe that you will make the right choice. We also are well aware that many Ohioans have been inundated with misinformation. And so I think we have an opportunity here so that, the other state doesn't look at Ohio and say, boy, it's tough to be in Ohio right now. I think we have an opportunity to stop the train. I really do. And I think if we do the basic public health measures, as Dr. Deuce alluded to, that have gotten us here, half of us are vaccinated, we can do better. Let's do that. We have a choice to do that right now and make a difference for our kids.
And I echo what my colleagues have just stated. I'm certainly concerned as an emergency medicine physician with our local schools in this area returning this week and within the next couple of weeks moving forward about a potential outbreak within our schools. Many of our schools in this area have elected not to mask at this time or mandate a mask. And knowing that that's our highest risk population and many of them have been unvaccinated, definitely under the age of 12, there could be an outbreak and it could ravage through our community very quickly. As a clinician in a small rural hospital, our capacity could be overrun rapidly. And then we rely on tertiary care centers like Akron Children's, where Dr. Forbes is at. I can only encourage everyone to get vaccinated that's eligible for vaccine. And if you aren't eligible, do everything you can to prevent the spread of this illness. Again, it's a preventable illness, and we need to do everything we can to get out of this pandemic and prevent any additional spread throughout our schools. We need our children to be in schools academically. We need them to be there for mental health reasons and physical health reasons. And the best way to keep our children in school is to prevent the spread of this illness.
Thank you, doctors. Our next question is from Jim Province with The Blade.
Hello, doctors. Dr. Vanderhoff, do we expect the boosters to be the same versions of the vaccine that we've already been using, or a variation in the future that might target Delta better? And also, are we going to have to do this every 8 months?
Well, those are three excellent questions, and I'll try to hit them briefly. First of all, as we are looking toward what ACIP and the FDA will be considering as prompted by HHS and the administration, we're certainly talking about the current vaccine and whether their estimation is that the scientific data supports a third dose, a booster, for people who've received it a number of months before. So yes, that's the same vaccine. However, simultaneously, major pharmaceutical companies, including Pfizer and Moderna, are actively studying augmented boosters that have taken advantage of the knowledge we have of the changing nature of the virus, including the variants we've been confronting, and testing whether those, I'll call them augmented vaccinations, would serve as effective boosters or offer any advantage over our current vaccine as a booster. But that research has a process that it must go through, much like the first vaccines did. So that's a little bit off down the line. And then, in terms of what are we looking at here long term? Well, ultimately, what we as physicians are hoping for, and why we're encouraging vaccination so strongly, is that when we collectively develop a very substantial immunity in the community, what will ultimately happen is that together we will, through our immunity, be able to reduce the opportunities for this virus to sort of, play the lottery and have new versions of itself emerge that are able to escape our immunity. And because we'll all have quite a bit of immunity, the virus that's out there will begin to look to us a whole lot more like the common cold. It'll be something that we'll see, our immune systems will react to. We might have a mild illness, but now we've augmented our personal immunity, and that will happen over and over and over. And this virus that is now driving hospitalizations in large numbers will no longer be doing so. So it's really not the goal of getting rid of COVID. COVID has existed actually as a cold virus in other forms for a long time. We're going to see COVID-19 and its lineage around for a long time, but we should be able to get to a point through immunity where we're not going through these constant cycles of waves of serious illness. And let me turn to my colleagues, my physician colleagues, who I'm sure can speak very well to this. Gentlemen, would you have any brief additions to that? Maybe I'll start with Dr. Deuce this time.
Yes, thank you, Dr. Vanderhoff. For the best protection is preventing the virus from mutating. We must stop the spread, and that's with vaccination. And if we can stop these mutations, we'll get ahead of the virus, just as you mentioned. It'll just become a common cold. So in short, I think it's unlikely our immunity wanes to the point that we have continued serious illness. It's just a matter of preventing these mutations. And the only way to do that is to get ahead of the virus, and that's through vaccination and stopping the spread.
I think very quickly, what I will add is the nature of coronavirus. I think understanding the enemy, so to speak, is very important, and for me, a real motivation to get vaccinated. And that is, when we think of the 5 outbreaks so far since 2000, right? We've had MERS, which was coronavirus. We had SARS, which was coronavirus. We had Ebola, and now we're dealing with COVID-19. So 3 of the 5 major outbreaks have been coronavirus, and in 18 months, it mutated again with a Delta variant. And so I'm going to echo what Dr. Vanderhoff said. If enough of us get vaccinated, the likelihood of mutations with this particularly virus that likes to mutate, it just goes away. And so get good information, get the vaccine if you're eligible, wear your mask in the meantime. Because if you're unvaccinated, the virus is more likely to use you and those that are unvaccinated around you as kind of a lab and just create a brand new strain for us to deal with. And so we can do this. We can do this. And I think we know enough to do this and make the right choice.
Thank you, Dr. Forbes. Our next question is from John Reed with Gongwer.
Good afternoon, doctors. Quick question about the booster shots. How prepared is the infrastructure, the supply chain, and providers for administering probably a new rush of millions of people wanting to get a shot, all probably mostly coming around the Thanksgiving, Christmas holiday season?
Well, thank you very much. It's an excellent question. Of course, a lot depends on the details, but what appears to be emerging is a target of beginning the process late in September and then moving along as we essentially moved along at the beginning of the vaccine, saying to people, look, the data on immunity through 8 months is really very, very good. Since there are some early indications that there might be some waning immunity to the mild to moderate illness, let's take that as a cue to go get a booster after that. We're talking about something that will happen over a period of months for the total population. We're actively reviewing that with all of our partners. And here in Ohio, we're actually fairly confident that we've built a robust enough vaccine infrastructure that has continued to work in giving vaccines that we're very confident that we'll be able to meet the needs of people as their turn comes. Emphasizing the fact that, of course, there is actually no indication right now that the primary endpoints, the primary goal of these respiratory vaccines of preventing serious illness and death is changed. That appears to be very durable. It appears to be very stable. But I think it's out of really an abundance of caution looking at some of that early emerging data about less severe illness, which the vaccines are by design not as good at addressing. I think that abundance of caution is leading to this preliminary recommendation. Long story short, we have been actively preparing for this potential, and I think we're fairly well prepared.
Thank you, Dr. Vanderhoff. Our next question is from Joe Ingles with Ohio Public Radio and Television.
Thank you, doctors. While the numbers on the state's coronavirus website show the breakthrough COVID rarely results in hospitalizations or deaths, there are no numbers that show the prevalence of breakthrough COVID in communities. And many people who are vaccinated falsely believe that they're now protected and can go out without worrying about the risk of contracting COVID. But as you know, some of these mild cases of COVID can be a problem for some people. Some may be immune compromised, living with someone who is. So without showing all of the breakthrough cases, isn't the state putting many people at risk who, if they had the knowledge in hand, might make different choices?
Well, thank you so much. It's, of course, a question we've addressed now a number of times, but I'll reiterate what I've said before. First of all, we need to remember that protection against severe illness and death was, in fact, the original target of these vaccines, that these are vaccines against respiratory viruses, and that kind of vaccination rarely protects against more mild forms of infection, as well as it does against serious illness. It was really stunning to the medical community that there really even was substantial protection against mild to moderate illness when these vaccines came out, because it's almost unheard of. But it's really a testament to how good these vaccines are that that's even a part of the picture. I think you're right that unfortunately, these vaccines are so good that people began to assume a level of protection that is really not part of their design or part of how our immune system interacts with this kind of virus. However, having said that, there are also problems with how to collect good and reliable information about those lower levels of infection. And much of the information that we have is actually coming from targeted medical studies, where they have people enrolled in those, or they're working through healthcare providers who are able to directly gather that information. Gathering that information accurately across an entire country or across an entire state is really fraught, because so many people who become mildly or even moderately ill with a respiratory virus like this don't even seek testing or medical attention. As a result, the best data that we have to share on a regular basis, the most accurate data, is that which is collected at the point of our hospitals. Because when a person gets severely ill with COVID, they reliably show up at the hospital. And so not only here in Ohio, but across much of the rest of the country, that has been the standard. I'm aware that there are states that have tried to gather information about those lesser cases, but the reality is, and we concur with the CDC on this, that's neither telling us much about the endpoint of vaccine efficacy, nor is it nearly as accurate outside the setting of these structured studies that have ways of being in connection with people who might develop less severe illness. So gentlemen, this is probably more in my sphere than yours, but I'd be open to any further comments either of you might have.
All right, thank you. Our next question comes from Justin Dennis with Mahoning Matters.
Good afternoon, doctors. Thanks for taking our questions today. Here in the Mahoning Valley, recently had a Friday school football game canceled because of team members who contracted COVID. When you take Delta into account for this upcoming school year, how is the guidance for sports extracurriculars different now? What should people putting on these programs be thinking about?
Well, I would say that the school's guidance that we've provided, along with the quarantine guidance, really is where people should be turning their attention. And, you know, our guidance has continued to be that in extending this to the extracurricular environment, whenever it is reasonable and safe for those participating in the extracurriculars, that they too use these layered prevention strategies, including masking. You know, the ideal environment would be for everyone in these extracurricular environments and these sport environments to be fully vaccinated. Because if both teams were fully vaccinated, even mild illness that a small number of them might develop really would be of minimal consequence to the other team members. We would be getting closer to that kind of substantial community immunity that my colleagues and I were referencing earlier. So, you know, I think that's my perspective. Again, I'll turn to my colleagues, Drs. Forbes and Deuce, to see if they would want to add anything. Maybe Dr. Forbes, would you want to lead?
Sure. Yeah, again, I would echo what you said. I think if enough people are vaccinated on both of the teams and all the coaches, then it frankly becomes like rhinovirus or, you know, these common winter viruses that we deal with all the time. But without those layered protection strategies, you're just wide open. So again, I think following those guidelines makes perfect sense to me.
Dr. Deuce, you see these folks in the emergency room. Anything you'd add?
Yeah, several things. First, I think our athletes and coaches need to be honest and forthcoming if they develop or have any symptoms of COVID. You know, as we mentioned, it's preventable, and we certainly don't want an athlete on the field or a coach in that environment potentially spreading the illness. You know, as far as our spectators, vaccination is the best prevention we have. I think we need to continue the layered approach that we've discussed throughout the last hour.
Thank you. Our next question comes from Danny Eldridge with Hannah News.
Hello, doctors. Thank you for taking our questions. So this year, it appears for children under 12 that the situation is pretty much the same as last year. First of all, I want to know if you agree with that. And then if it is, or if it's more dangerous because of Delta, why is there not a statewide mask mandate and for children under 12, at least in elementary schools? And how much would that help?
Well, thanks for that question. I would agree that I do think that our children less than 12, because they do not have access to the vaccine, are facing a situation that has an awful lot of similarity to what they were facing last year. And of course, we have the benefit both of our experience last year of how good the school year can be when a comprehensive layered approach of safety, including masking, is utilized in the school, even in the face of COVID. And in terms of Delta, it is more communicable. It is definitely more contagious, but we do have indications from other parts of the world where they've looked very carefully, including the United Kingdom, at getting kids back to school. And I've referenced before a relatively recent Oxford study. It was really primarily looking at the issue of testing, but part of it was that they had the students masked. And they really found that the students did incredibly well in the school environment with masking and distancing, et cetera. So I remain very, very encouraged about masking and distancing vis-a-vis our experience from last year. Now, the question about mandates, look, the people of Ohio have a long tradition that I think is a very admirable tradition of local managing affairs locally. We're a very locally oriented state. And communities have indicated very, very clearly that their expectation, what they want, is the opportunity to have the information they need and to make decisions locally about how they'll live life in their communities. And I respect that. With that in mind, I think a mandate at this point would be counterproductive. What's important is for us to be working with the communities to get them this vital information and to rely on their wisdom and their care and concern for their children to do what's necessary to keep their children safe.
Thank you very much, Dr. Vanderhoff. It is now 2 p.m. and I believe that's all the time we have today. If you'd like to share any final remarks.
Well, first, again, I'd like to express my sincere thanks to both Dr. Deuce and Dr. Forbes. I can't tell you how helpful it is to have your frontline, your bedside experience to share with others. So thank you both. Thank you also to members of the press who have afforded us this opportunity and this time to share this important information and to be partners with us in cascading information to the public. So thank you.
Thank you very much and have a nice day.
Thank you.